Okay, so it is 3:30. I think we'll get started. So thank you everyone for joining us for our webinar today, School Anxiety and Attendance Challenges, Practical Strategies for Elementary School Professionals. Our presenters today are Dr. Alex DiGiacomo, Dr. Sarah Anderson, and Dr. Rosalind Catchpole. My name is Michelle Horn, and I'm the Program Manager for the BC Children's Kelty Mental Health Resource Centre. Before we begin, I would just like to acknowledge with respect and gratitude that I live and work on the beautiful unceded Coast Salish traditional territory, and I give thanks to the Musqueam, Squamish, and Tsleil-Waututh nations. I also wanted to provide a very brief overview of the Kelty Centre before we get into the presentation. So the Kelty Centre is a provincial mental health and substance use resource centre, and we help families across the province by helping with understanding and navigating the mental health system, listening and offering peer support from trained peer support workers through a collaboration with FamilySmart, and connecting families to resources and tools. We also provide resources and support to school professionals such as yourselves supporting children and families. A few housekeeping notes before we begin. So as mentioned, everyone is automatically muted and your cameras are turned off. You will have an opportunity to ask questions after the presentation. So if you have any questions, please submit any through the Q&A function. There has been an option enabled where you can vote for questions that you want answered, as well as an option to submit questions anonymously. If you have any technical questions, such as where to find the recording or issues with audio, please submit those through the chat function. This webinar will be recorded and made available on the keltymentalhealth.ca website. At the end of the webinar, a survey will pop up that we really would love for you to complete. A PDF of the slides will be posted following the webinar, and these slides will be sent out to you along with a survey link in an email that we're going to send to you tomorrow. We also just wanted to note that the information in this webinar applies to the context in British Columbia. If you are in another jurisdiction, please consult your local health and school authorities for further information. Okay, and to introduce our speakers today. So Dr. Alex DiGiacomo is a postdoctoral fellow in the Mood and Anxiety Disorders Clinic at BC Children's Hospital and the Department of Psychiatry at the University of British Columbia, as well as a psychology associate at Cornerstone Child and Family Psychology Clinic. She provides clinical services to children, youth, and families, and conducts research to better understand anxiety disorders. Dr. Alex has a particular interest in supporting skillful and confident parenting and in equipping children to conquer fears and challenges. Dr. Sarah Anderson is a registered psychologist in the Child Psychiatry Unit at BC Children's Hospital, as well as a psychology associate at Cornerstone Child and Family Psychology Clinic. She provides clinical services to children, youth, and families, and conducts research to better understand anxiety disorders. Dr. Anderson has a particular interest in supporting children and youth who experience difficulties attending or staying in school. And Dr. Rosalind Catchpole is a registered psychologist and head of the Mood and Anxiety Disorders Clinic at BC Children's Hospital. She is actively involved in treating, teaching, and research on anxiety disorders and has a particular interest in parent-led treatment approaches, including those for school refusal. She recently worked with the Canadian Mental Health Association to develop the Confident Parents, Thriving Kids Anxiety Program. She has also worked with Anxiety Canada to develop educational materials. She is a clinical instructor in the Department of Psychiatry at UBC and a director of Cornerstone Child and Family Psychology Clinic. So thank you so much, Dr. DiGiacomo, Dr. Anderson, and Dr. Catchpole.
Thank you so much, Michelle. Welcome, everybody. We've really been looking forward to this talk today. So Dr. Anderson, Dr. Catchpole, and I wanted to start just by acknowledging with immense gratitude that we live, work, and play on the traditional, ancestral, and unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh Nation. Okay, so let me start by giving you an idea of what we'll cover today. So we're going to start by digging into the theoretical foundation of school avoidance and relay what we know about it from the literature. Then we'll look at some practical strategies for assessment, which will then pave the way for concrete steps to coordinating a successful school attendance situation for your students. And then we hope that by the end of the webinar, you'll leave with a solid understanding of how to troubleshoot some of the common traps that come up when doing this work. But first, and this is really important to each of us, we want to say thank you to all of the school professionals and educators watching today. We really have nothing but respect and admiration for you and for your profession, and we're really incredibly grateful for how you support our kids. So our goal today is to support you, and please do feel free to let us know in the Q&A and in the feedback how we can do that better. Okay, so let's talk about what's behind the struggle. And first of all, when we use the phrase school avoidance, we're really talking about either challenges attending school or difficulties remaining in school for the entire day. And in both of those cases, the struggle that we're talking about is usually an anxiety-based one. So what we know from the research is that about 2 to 5% of youth actually have difficulty getting to school. Change that slide, due to anxiety. Now, those statistics, 2 to 5%, those are pre-COVID. And so we do expect that those rates have actually gone up since the start of the pandemic. And why would that be? So these struggles tend to be more common around transition times. So moving from kindergarten to grade 1, middle school to high school, after summer break, or like right now, coming back to school in person after a while of being remote or not in school at all for a while. So some of you might have been interested in this webinar because you have a student whose challenges in this area have actually gotten worse because of the pandemic, or you might be thinking of a student who's never experienced this kind of struggle before, and then now all of a sudden with COVID, they're having a hard time. I think it's also worth making clear here what we're not talking about. So although there can be some overlap, we're not primarily today talking about kids who are skipping school for fun or kids who are acting out. Let's go through a case example. We'll call him Alfie. So Alfie is a compilation of many of the kids who we've worked with along the way. And we're going to weave Alfie in at various points today throughout the talk so that you can kind of see the process from start to finish. Okay, so this is what you need to know about Alfie. He's 9 years old. He's in grade 4. His mother has recently been put on long-term disability leave. And this year, Alfie has had a few different periods of 2 to 3 weeks of non-attendance. So historically, Alfie hasn't had any trouble meeting academic expectations, but this year he is really struggling in math. He also tends to get pretty distressed whenever rules are broken at school. So he's one of these kids who is really oriented to justice and really prefers for everyone to kind of follow the rules. And as a result of that, he's begun to have some challenge fitting in with his peers. And he's often asking teachers to call mom throughout the day. And then recently, there's also been some meltdowns and some minor kind of aggression. So things like knocking over chairs.
So what we know is that, almost any child can struggle with school attendance, but these issues don't affect kids equally. So we do know that there are risk factors that predispose kids to struggle with anxiety about getting to school or staying in school. And they fall into 5 broad categories. So certainly social factors can play a role, either, negative social experiences at school like bullying, or social skills challenges that may lead to more peer conflict at school. Educationally, certainly kids for whom school is more of a struggle because of learning challenges or differences or developmental delays are at greater risk for school-based anxiety. In terms of family factors, what we know is that family conflict is a challenge for kids, as well as parental separation, particularly where there are quite different parenting strategies in the 2 homes. And then finally, with family factors, we see that those parents who really struggle with consistency and limit setting more generally can also particularly struggle with getting their kids to school. Mental health-wise, as you probably would expect, we see that anxiety disorders, mood challenges like depression, as well as experiences of trauma put kids at greater risk. And finally, we look at those larger societal factors. So kids who experience racism or economic vulnerability or other issues that make them feel less of a sense of belonging are at greater risk. One of the key take-home messages we really hope to convey in this talk is that early intervention is so important with these kids. It is so much easier to work on this cycle when it's really in the early stages rather than when it's been really going on for a long time. And so we ask those of you here as educators to really kind of keep your hats on to be thinking about, are you seeing kids who are displaying some of those early warning signs, those sort of insidious early factors that might mean that this pathway is getting started? And so those can look very different for different kids, but we look at things like a lot of physical complaints, particularly headaches and tummy aches, which we know are quite highly associated with anxiety. Other signs of anxiety in the classroom, really struggling, ripping up their paper because they don't feel like they've done an assignment very well, or being really nervous in those social aspects of school. Lots of trips out of the classroom, maybe to visit the school counselor, or maybe even just go to the washroom a bunch of times, can be a sign that the child is getting overwhelmed. As well as, particularly for older kids who may have a phone, those calls or texts to parents and lots of requests to go home during the day, or just attempting to kind of miss part or all of the school day. We also know that anxiety can show up behaviorally in kids. So if you see a change, for example, in a child's ability to pay attention or their overall class participation or mood or irritability, those are other signs that kids might be starting to struggle a bit more. And we won't spend too much time on this, but I think it is worth noting that, there are some short and long-term impacts for kids, for some kids anyway, when they struggle with school attendance. And so shorter term, as we would expect, we can see poorer academic performance as gaps start to come up in the knowledge that they have, as well as increased social stress and isolation when they haven't been around their peers as much. And school non-attendance is a risk for depressive disorders in kids. Longer term, we know that it can impact their educational and employment opportunities, as well as contribute to that, what we call that sort of failure to launch picture, where that transition from adolescence to adulthood really gets kind of stuck. And there is a higher risk for psychiatric disorders. So all really important reasons why we want to intervene early.
So before we talk about some practical strategies to support these kids, let's talk a little bit about anxiety, because really understanding how anxiety plays out in school is such a powerful tool. So we know that anxiety exists on a spectrum, and it really is a normal and necessary human experience that is adaptive, and in many ways keeps us safe. Like if a car is speeding towards us and we need to jump out of the way. But sometimes that alarm system becomes faulty and it will alert us of danger even when there's no true danger. And that faulty alarm system needs to be retrained. So that experience of anxiety is also not harmful to us, but is really uncomfortable and sometimes incredibly so. Anxiety might look like things like worried thoughts, uncomfortable physical sensations like increased heart rate or sweaty palms, and distressing emotions that send the message that we need to avoid that thing that's causing the distress. It could also look like, as Dr. Catchpole mentioned, externalizing behaviors sometimes in more severe cases, which could be exhibited as property destruction or harm towards others, for example. So the other thing that we know about anxiety is that it improves if we keep facing hard things instead of avoiding them. So let's take a look at how this works. So when your student's anxiety is increasing at school, this is really hard to see as a supportive adult. However, what we know is at its peak, our bodies can't actually sustain that high level of anxiety for long, and that anxiety will come down on its own if your student stays at school with the right supports. However, let's say, for example, your student's anxious about their math quiz this afternoon and it indicates to you that they want to go home. Their anxiety is increasing in that moment, And then you say, okay, fine, you don't have to do the quiz today, but you have to do it tomorrow. So they're going to experience that immediate sense of relief, that decrease in their anxiety, but without having had the opportunity for that anxiety to come down on its own and for them to be able to face that thing that they're afraid of. So the main kind of take-home message here is that if we let the student leave at the peak of their anxiety, they will then associate leaving school with feeling better. So the second or third or 20th time your student faces their fear, their anxiety is going to be a little bit less than the time before and will similarly go down on its own. And after many repeated practices or exposures, that anxiety will continue to decrease on its own until it's manageable and may no longer even be a concern. However, the student who avoided facing their fear, such as by going home on days when there's a math quiz, they're going to experience even more anxiety the next time they're asked to face their fear and to stay at school. And they're going to be even more hard pressed to do so. So this just really illustrates the premise behind research supporting effective ways to face our fears and underlines that we're not trying to get rid of anxiety, even in professional treatment. Rather, we are seeking for students to cope with their anxiety, to decrease avoidance, and by doing so, we're breaking that association between leaving school and feeling better.
Yeah, so just like Dr. Anderson spoke about how anxiety can feel really uncomfortable, it's also very uncomfortable sometimes to witness in another person, especially if the person is someone that you care about. And since you're school professionals and educators, I'm sure that you really care about the kids in your schools. And so I want to highlight two sort of automatic ways that we might respond when kids are distressed and avoiding school. And for some of us, we tend towards one or the other. And for others of us, we might notice ourselves doing each of these depending on perhaps the child or the situation. So on the one hand, we might default towards being too soft. So we might be thinking things like, this kid is so upset. Should they even be here? I don't want to push them. I really want them to trust me. And then on the other hand, we might default to being too tough, thinking things like, these absences are not acceptable. They can't be allowed to get away with this. And the point really is that while these responses make sense, they're understandable, and they're really common and well-intended, ultimately they're not helpful because they get in the way of kids learning that they can be brave and face their fears. And so what we know from research is that helpful, skilled responses contain two things to anxiety. So you can remember them as the two E's, and those are empathy and encouragement. So if we miss the empathy part of it, we can end up being a little bit too tough. If we miss the encouragement part of it, we can end up being a little bit too tough. So it's important to empathize with the child's distress, even if we don't understand why they're so distressed, to empathize with that, and also to communicate confidence in their ability to attend. And this is important to direct this both to kids and to their parents. So to a child, you might say something like, I know it feels hard being here, and I know you can do it. You're so brave. To a parent, you might say something like, I know this feels really stressful and it would be easier to keep him home. And I know he's going to get through this one day at a time. Great work dropping him off. So we're thinking about these undertones of both warmth and structure. So one of the reasons our messaging to both kids and parents is so important is because they take cues from us. So when we're more on edge, parents are more on edge and kids are more on edge. And especially kid fear and parent fear really build on each other. The good news, though, is that they take cues from us. So we can influence the cycle by communicating confidence. So regardless of whether we feel it, we can kind of introduce this cycle of confidence as opposed to anxiety building and building. So really the key thing to remember here is communicate confidence even if you don't feel it. And it's okay not to do this perfectly. None of us do. So the key thing is that the majority of the time, this is what we should be trying at least to communicate to families.
Great. So we're about to dive into the really practical part of this talk where we give you some really concrete strategies to use with these kids. But before we do so, we felt like it was really important to have a bit of a note here on self-compassion. So it is not easy supporting these kids with school attendance challenges, especially when they're very long-standing. These kids can be really distressed in the classroom, and it can be a lot. As school professionals, you have many competing demands. You don't have the luxury of working one-on-one with a child like we sometimes do. And so we really want to give the message that it's unrealistic to support families on your own, particularly when things are more challenging. A team-based approach is essential, both to be able to coordinate things, but also to avoid burnout. Okay, so let's dive in here. You have a student who you think might be having difficulty with school attendance. We're gonna go over 5 steps that really will help support these kids and youth and get them back to school or get them staying in school in a really optimal way. And we'll go over these in detail, but those are: identify and gather the team, assess the struggle, set the stage for success in communicating with the family, develop and implement the plan collaboratively, and then keep communicating and checking in. Okay, so step 1 is really to identify and gather the team. Back to that point about wanting to make sure we're not working in isolation and risking burnout. So coordination at all levels is really key to successful outcomes. And so step 1 is really to identify who is on the child's team. So that's going to be their caregivers, which school professionals are going to be part of the school-based team, and really making sure we identify that. And if there are any external mental health professionals or health professionals involved, we may want to gather them together at the beginning as well. And one of the key questions at this early stage is really, who's the school point person or people, if that's a shared role, going to be? Because that is going to be the person that's going to lead the assessment with the child and family and facilitate the development of the plan. And that's going to be the person or that shared role are also going to have responsibility for communicating with the family and the rest of the school-based team and any external mental health professionals. We really need this to happen in a coordinated and consistent way for it to go well.
So step 2 involves having that indicated point person or point people conduct a thorough assessment of what's going on for the student and what might be contributing to their challenges with school non-attendance. So along with a history, taking a thorough history of their school attendance, we want to look at whether there are any learning issues, whether there are mental health challenges, whether related to anxiety or otherwise, whether there are social or other kinds of stressors that are ongoing for them at school, and whether there may be some stressors within the family or at home. It's also notable that the intervention approach in this talk is really based on the premise that school avoidance for that particular student is related to that anxiety false alarm. So if the school avoidance is instead related to a lack of safety, whether that's physical safety or emotional safety, or threat of violence, such as through racism or bullying, really a more systemic approach is needed. Okay, so the methods by which we would conduct a more comprehensive assessment include talking with the caregivers and, if appropriate, if old enough and if the family would like, with a child as well. So this would involve taking a really thorough look at school records, including their sort of educational history, as well as looking at their school attendance. We recommend using the School Refusal Assessment Scale Revised, which is available for free online. There is a parent as well as a child version of this, and I'll talk in the next slide a little bit more about how to use that. This might also involve talking with other relevant school professionals. So in our experience, it really depends on the school and the individual child who may have been involved actively in supporting that student over the years. So whether this is a school counselor, whether this is a resource teacher, whether that's, their grade 3 teacher that they had a great relationship with, it's really going to depend on the student. So there's also more information to walk you through this process in detail in that accompanying document. It's sort of a workbook style document that Kelty will be sending out tomorrow. So using that school refusal assessment scale that I talked about is a great way to better understand what might be keeping or maintaining those challenges with school non-attendance. It's not necessary that you use that, but it is a helpful tool to do so. So we think about negatively reinforcing functions as those that include things that result in the child escaping bad feelings, such as not having to do a class presentation they were nervous about, or missing a test, or missing having to navigate social situations at recess. And we also think about those positively reinforcing ones, which are sometimes actually quite a lot more subtle, such as having alone time at home during the school day, or special attention with a caregiver, or time with a caregiver when there are not other siblings around, or access to social media or electronics at home during the school day. And another important area of note and assessment is accommodation of avoidance. And this can really easily occur by the most well-meaning and supportive adults. And this is when you allow for that avoidance, such as by saying, okay, you don't have to do the math quiz today, but you have to do it tomorrow, when seeing your student in distress. So what we know is that this definitely helps to reduce distress and behaviors in the short term, but it's actually going to contribute to more distress and more behaviors in the long term. So after looking at how much school your student is missing and how long this has been going on for, this will indicate what level of risk or severity of school non-attendance they can be categorized as, roughly speaking. And this is helpful to both identify these students as early as possible, as well as to inform the level of intervention and supports that are needed. So this also helps to identify which team members might be needed to support this particular student. So in many cases, children with more significant or more long-standing school non-attendance require additional support, such as, for example, external mental health professionals. So what we know about doing this work is that careful coordination, communication, and consistency between team members is really key. And clarity around roles significantly increases the chance that a plan is going to be successful and that team members won't experience burnout. So really, we think about the school team as being responsible for developing and executing those school reintegration plans or those school reentry plans, setting up those internal school meetings, like a school-based team meeting, and liaising with mental health clinicians, if applicable, and with caregivers. If there is an external mental health clinician involved, we think about them as being responsible for either that individual therapy with a child or that parent support or parent training with the caregivers, as well as consulting with the school team and attending those crucial school team meetings and keeping the school really apprised of plans and progress so that there is that sort of consistency between different settings and expectations. When it comes to caregivers, they're responsible for a number of really key areas, such as communicating confidence and setting effective limits with your students, making sure the home setting is boring during school hours, and ensuring sort of basic needs like that the child is getting enough sleep and that they're actually awake and out of bed in time to attend school. With regard to the child, they're not responsible for wanting to go to school or talking about going to school. Really, their key responsibility is just being brave and pushing themselves to go to school.
Okay, So now we've done a nice fulsome assessment. We have a team. Now it's time to set the stage for success and communicate with the family. So this step is usually done by a point person or point people if there are two. And I think as school professionals, you're really poised well to do this in a validating and encouraging way. So now you're coming to them, to parents and families, and you're saying, look, we know this has been tough. You're empathizing with the struggle that they've gone through, because it's not easy to have a kid who is having trouble going to school. And at the same time, you're offering hope that things can get better and that you know kind of what to do, what the plan should be to get on a better track. So one of the key goals here is really normalizing the struggle, communicating confidence, and beginning to introduce the kind of stepwise way that we're going to help to bring things back on track. And this would also be a good time to think about bringing in some kind of external mental health professional if you think that that would be warranted in the more kind of severe cases. And the extent of the child involvement in this step would really depend on the child's age. Okay, so step 4 has 2 main steps. The first one is developing the Bravery Ladder and then planning the school reentry. So the Bravery Ladder, even when kids are really young, this is a kind of a process that should be done collaboratively. So the whole point of a Bravery Ladder is to, in small steps from kind of easiest to hardest, begin to face fears so that the goal can be achieved. And in this case, it would be getting back to school. So when we're thinking about the Bravery Ladder, this is the time to go back to the assessment and remember, okay, what were those things that were kind of barriers for getting, let's say, Alfie back to school? So you're keeping those in mind when you're thinking about the Bravery Ladder. And I'm going to show you one in a second. Here is where kids might start to get anxious and nervous because they know that they're going to have to start kind of facing things that are really, really scary. So we find that keeping this light and fun can help reduce the anxiety. So for a young child, like, you're wanting to kind of hear from them, okay, what would be an easy first step? What would be harder? And so you could play games like hot and cold. So get them to kind of move towards you if something's easier, move away from you if something is harder. So you're keeping it light, and and you do not need to know all of the steps of the Bravery Ladder at the beginning. So let me show you Alfie's ladder. So let's go back and remember. So during the assessment with Alfie, what we learned is the reason he wasn't going to school is he's feeling really anxious and ashamed during math because he was struggling. He wasn't doing well. He didn't want to separate from his mother, and he was having challenges with certain peers. So I just want to say, kids can have different ladders, so we don't want to do too much too soon. So our first goal with Alfie was just to get him back to school. Okay, so one of the most important things to know about Bravery Ladders is each step should be associated with some kind of reward, a specific reward. And we find that this is a time where kids can really contribute a lot because they know if they would rather have, let's say, 15 minutes of screen time versus a candy or whatever it is. So that's a way to get them involved and maybe excited about it. And then, of course, there's a brave step for every reward. So you want to start with something that you feel really confident that the child can do. So you want to set them up for success. So in Alfie's case, we decided, okay, he's going to walk to school and back with mom. That was something that everyone thought was doable. He did it. He gets to choose his dessert. He's feeling good, ready to go on to the next thing. And the important thing to keep in mind here is, what were the things that he was scared of? So he was having trouble separating from mom. So that's why for the first step, we didn't make him separate from mom. We let her come with him. And then you can see these various steps all the way up until, okay, he's attending school for the morning until lunch. So we're mindful of, okay, math is really hard. So when we do the math, we're only going to get him to do 15 minutes in the resource room. And then once he's back in, we had some other ladders where we were kind of looking at the anxiety with math specifically, or getting him to feel more comfortable with other peers. But this ladder was really to get him back in the classroom, and you'll have access to this as well.
Great. So the next step, once you've developed the Bravery Ladder, like Dr. Alex was talking about, and we know what some of the early steps are, there still is a second part to this step, which is that we really want to plan the school reentry to make as many of the unknowns known, and to know as school professionals who's responsible for what and when, really practically. Like if someone is meeting the child on the playground, to kind of hand off from dad or mom, who's that going to be? What time is it going to be? For a kiddo like Alfie, who's a little bit older, often, in addition to the worries about being at school, they also get worried socially about, what am I going to say about why I was away? What am I going to do if kids ask me where I've been? Or what's up with the seating arrangement? Is it the same as before I was, off school, or has it changed? So we want to make sure we address all those logistical concerns with the child and the caregiver right up front. Other kids who are older will also worry about, like, am I going to get a pile of homework when I first get back? So just really making sure we're really clear what's going to happen. And then to communicate those expectations to the child really clearly. And with a younger child, that might just be, tomorrow we're going to do circle time and you won't have to raise your hand, so that they know kind of what the plan is. And for Alfie, it might be something like, tomorrow you'll sit at your desk, but you don't have to do any work. You can just sit and listen. The next piece of this is deciding on accommodations. So as educators, you use the term accommodation a little bit different than we do as psychologists. And really, we're talking about both in this talk. So what we're trying to avoid is that accommodation where we're letting the kid leave at the peak of their distress. And that can happen both from being too soft and from being too tough in a way, because if we've jumped up 5 steps on the Bravery Ladder and the kid gets really overwhelmed, that's when we can see more of those big behaviors or that avoidance really creeping in. So what we want are helpful accommodations that provide some scaffolding to the child as they work their way back up. And so these might be things like access to a point person at school. If they need to have a chat, calm down, who's that going to be? How are they allowed to go, and that kind of thing. Or access to just a calm down space, even within the classroom or potentially without, if they're getting a bit overwhelmed. Academically, we want to think about what accommodations are needed in the short term or the longer term. So for someone like Alfie, who's really stressed about math, we may decide that we want some good accommodations in there so that maybe for the next little while, Alfie is only doing some math in the resource room, or he doesn't have to do as many questions as the other kids, things like that. And then finally, another one that's really key for a lot of kids are, what are those social support things going to look like? Particularly if kids are acting out at all as part of their anxiety. We don't want the plan to be going really well until recess, and then there's a conflict on the playground and everything goes backwards. So really looking at things like, do they need a little bit of social support during unstructured time, or are there particular situations, maybe they're sitting with a peer that they don't get along with as well. And so just really kind of looking at what of those pieces are going to help this go really well. And the last point here is, we really want to document this gradual re-entry plan so that the whole school team and the external mental health professionals, if they're involved, and the caregiver and the child know exactly what's going to happen. The worst thing to do from an anxiety point of view is to occasionally let them escape. And that can happen just when we don't have a solid plan, because everyone is really busy. So consistency of implementation, that this is happening Monday and Tuesday and Wednesday and Thursday and Friday, is really key, especially in these early steps of getting back to school. So if it's documented well, that just helps everybody really be on the same page and set this up for success. And the last step, which we don't go into tons of detail, but is actually really, really important here, is to communicate and check in. We need a plan for ongoing check-ins among the team to ensure that things are going in the right direction and the gains that we have achieved are continuing. And it's not uncommon, as I'm sure you all know, to hit some barriers sometimes. And we need to troubleshoot those and make sure we have the right things in place and the right people involved to be able to address them. So for Alfie, let's say, we see this really commonly. Let's say sleep had gotten out of whack at home and he was up really late. And so he was really tired in the mornings when it was time to go to school, which is not going to help an anxious kid. Alfie's mom may need a bit of extra support around how to do those good bedtime routines, how to set those limits, maybe how to limit the screen time in the evening so that that's not a barrier. Or as I mentioned in the last slide, let's say recess is a challenge. And so things were going well the first few days, but then there was a conflict on the playground. And then the next day he didn't want to go. We really want to be thinking about, okay, what can we put in there to deal with that particular fear or that particular anxiety? The last point I'll make is regular communication with caregivers is really important. This is, as stressful as this is for school professionals and for folks like us, it is really, really hard for caregivers because they're the ones dealing with the tears and the meltdowns in the morning and the pleading not to go to school. And so it's just such an effective intervention in and of itself to have that regular communication with caregivers to say, hey, he did great today. I know he was teary when you dropped him off, but he settled in really well and he did a great for that hour that he was there. So that will really help to decrease their distress. And as we know, lower parent distress will lead to lower child distress and vice versa. And so we could talk about this for so long. There's so much to say. So we just wanted to leave you with a few tidbits in this area that are some tips for success. And so the first, as we've said already, is really try not to let the kids escape at the peak of their distress. They'll learn that anxiety goes down when they avoid. And this is one of the reasons, by the way, when we have a fear ladder, if the step is that they're there for an hour, we don't necessarily want to have them stay if things are going well. Because if they amp up and get more anxious at hour 2, and then we're like, oh no, they've already done their hour, let's let them go home, then they're kind of remembering that more anxious state. So we ideally, wherever we can, try to have it settle and have them go home at a time when they're feeling better. The second point is, remember, it is normal and expected that kids are going to be nervous and protest facing their fears. Even when kids want to get back to school, they're still really nervous about these early steps. And so you expect a little pushback and some discomfort and apprehension at the beginning. The third point is some careful, planned ignoring of anxious behaviors can be really helpful, as well as a little distraction. So if kids are maybe slightly misbehaving, they're kind of dragging their feet walking to class, or they're sort of kicking at something on the ground, we just want to ignore that and focus on the hey, great job walking with me. Oh, cool, look, there's a new poster on the door, rather than kind of getting drawn into that anxiety. And similarly, kids will also do a lot of negotiating and talking about things and maybe trying to redo the fear ladder, right as you're walking into the school. So we want to avoid those prolonged conversations and reassurance seeking when we're really on that step. It's time for those conversations at a different point. And so when it's go time, we just want to keep things moving. Remember to praise and reward bravery, even if the step seems tiny, because the success really breeds success in this situation. And forgetting the rewards, which we all do as professionals and parents, sometimes is not ideal. So just really remembering, yes, they get their reward today and tomorrow and the next day is helpful. And just remember, each time they do a step, their confidence increases. And we tend to see a nice momentum in this situation.
So we wanted to provide just a brief overview of what mental health support might look like for these cases that are a little bit more moderate or severe. So what we know from the research is that these students and families are most successful when we use a 3-pronged approach that involves caregiver supports and really building confidence and competence around using behavioral strategies, school consultation and collaboration, which we've talked a lot about today, and sometimes, in some cases, individual support for the children as well. So each of these individually might have some success, but a coordinated effort is necessary to support kids that have been out of school for a longer period of time, have more entrenched avoidance, or might have multiple comorbid challenges or are facing systemic factors that are contributing to their non-attendance. Okay. So just in terms of a snapshot of what some of these goals might look like specific to caregiver support and developing some confidence around behavioral strategies, this might be learning ways to respond effectively to anxiety-driven behaviors like nagging, negotiating, having temper tantrums in the morning before heading off to school, as well as how to respond skillfully to anxiety-driven emotion. And again, oftentimes the most well-meaning and supportive school professionals, mental health professionals, caregivers alike may approach this in a way that it's counterintuitive but isn't helpful to the child because it may be actually accommodating the avoidance. We also want caregivers to feel confident in setting clear and appropriate expectations and limits with their kids. Similarly, we see that in this population, there are oftentimes lots of challenges around sleep. So whether that's having a reverse sleep-wake cycle in some cases, or getting to bed too late, feeling really tired in the morning, having a hard time kind of getting up, initiating, and getting off to school. We also really want caregivers to feel comfortable making the home setting boring if and when their child is at home during the school day. So it would surprise you the amount of times that in having conversations with families, we hear that there are a lot of really positively reinforcing things that are going on at home during the day that probably are maintaining that child wanting to stay home. And then lastly, we want caregivers to feel comfortable developing or having support to develop a reward system that is contingent on school attendance. In cases where individual support is necessary, and it's worth mentioning too that these cases are not necessarily rare, but we always really want to prioritize that caregiver support, building confidence around behavioral strategies, and that school consultation and collaboration piece. And this would be the piece that comes last after that if additional support is needed. So if there are challenges around anxiety, the gold standard treatment for that would be cognitive behavioral strategies. And a big focus on that is that kind of practiced exposure. If there are other mental health challenges at play, there may be other types of therapies or strategies that are used, such as motivational interviewing techniques used to kind of build engagement and motivation, or social skills training if there are challenges around social communication and engagement, or executive skills training, for example. Many kiddos may also have the need for medication management on an ongoing basis, whether that's a pediatrician, a GP, or a psychiatrist. So making sure that they're having that regular kind of follow-up and support with that too. And then we see in this population that there's just a higher rate of kiddos who have chronic health concerns that may have actually led to school non-attendance to begin with. So of course, there are many legitimate appointments and accommodations that might be in place, but really supporting and collaborating with those team members as well to understand what kinds of supports and accommodations are necessary and how we might be able to modify those to keep the student as engaged in school as possible. So lastly, we want to leave you with some take-home messages today. So really understanding the reasons, those functions underlying the school avoidance is really important. So going back, conducting that thorough assessment. And that really points to how important early intervention is. And we know that the earlier we intervene, the earlier we see these warning signs, the better chance that student has of kind of getting back on the right track quickly, and us not necessarily needing to use as many supports to help them get back to that place. We also need the intervention to match the severity of the avoidance. So a child that's been out of school for many months or years is going to require a very, very different, very, very coordinated effort involving a number of people versus a student who may be attending school regularly, maybe missing a day here or there. This work is really hard, and it's really hard to see our students, our kids, experiencing distress. But we have to expect some anxiety and distress in doing this work. And again, to go back to Dr. Alex's points earlier, eliciting or showing that confidence in those kids, in those families is really important to their success. And lastly, we just want to leave you with the point that this work is possible. School avoidance, school non-attendance is treatable with good coordination. So we've included some resources here, and these slides, again, will be sent out to you, so you'll have access to this. We've included the link to the Kelty mental health site here, as well as just a reference to the name of that school refusal assessment scale. I believe links to that will be sent out in the email tomorrow, but you can also Google that. A free version is available online. Child and youth mental health, for those that aren't familiar, those are mental health services for children, depending on the area in which you live, with locations all across BC. The Confident Parents Thriving Kids program, this has a subsection which Dr. Catchpole was involved with developing for kids that have more challenges around anxiety, and this is for caregivers. And we've also included a link to our previous webinars on school attendance challenges that was more focused on supports for caregivers. And lastly, we've included the site for Anxiety Canada, formerly known as Anxiety BC, which has many, many great resources to access.
Great. Well, thank you so much, Dr. Anderson, Dr. DiGiacomo, and Dr. Catchpole. Just such a wealth of helpful information and strategies. So thank you so much for that presentation. I see there's lots of really fantastic questions that have been asked in the Q&A icon. So I think we'll jump right in so we can get to as many as possible. And just to note, if we don't get to your question, please feel free to email us at the Kelty Center and we can respond to your question that way. We'll put our contact information up on the very last slide. Okay, so moving into the questions. So the first question for the presenters is there a threshold at which we need to back off? So for example, if the student is trying to kick down doors or run away and they're struggling a bit with a too hard/too soft balance. There was another similar question about looking for ideas and strategies for kids who run from classroom or out of the building when under stress.
Yeah, so I can start, and Dr. Anderson, Dr. Giacomo may have some things to say as well. So, I mean, yes, absolutely, there has to be classroom safety. I think what I would think about most in this situation is a lot of the time when this is happening, it's because the kid has figured out that it works, right? So they're starting to maybe get a little bit overwhelmed, and then they kick over some chairs or they push someone, and then they get to go home. And so when we're looking at sort of moving up the ladder of where kids are sort of able to tolerate, it's so much better to have a kind of a preemptive break in than to let them kind of escape at that time where they've become aggressive or they've run off. So you want to kind of go back to that assessment of like, okay, usually, in most situations, my student lasts half an hour, and then this starts to happen, or maybe it's even quicker during math class, and really look at, great, is there someone that can take them for a bit of a walk? Can they have a little helper job during one of those times, so that we try to avoid that cycle where they hit someone, they get to go home early, and maybe they go through McDonald's on the way home, which is going to make our jobs a lot harder.
And I would just add to that too, this is where kind of determining who those two team members are is so important, because again, we know that there are so many competing demands in a classroom, and if we were expecting the classroom teacher to take all of this on his or her own, that probably would be, that would be too much to ask. So if there are other support members who are available to come in and kind of contribute to that, or to support the child in the classroom or outside of the classroom during those times, and that can be planned in advance, that will just make it much more likely that you're going to feel successful and you're going to know what to do when this behavior happens, instead of feeling like, oh my gosh, I have to deal with all these other students. Okay, it's time for this student to go home.
Great, thank you. So we'll move on to the next question. So on the Bravery Ladder, do we stay on a step until the anxiety associated with that step drops to a level that the student can cope with?
So I can answer this, and feel free to jump in. So I would say we want to be thoughtful and planful about how long we're staying on a particular step on the ladder. We want to sort of balance it so that, yes, the student's experiencing some decrease in anxiety or distress on that step. And in some cases, it may be that the student does that step one time and they're feeling a little bit better and they're ready to move on to the next step the next day. There may be other cases where the student needs to stay on that same step for a number of weeks at a time until their anxiety has come down a little bit, they're a little bit more regulated, a little bit less distressed. If you're noticing that we've been on this step for a long time and their distress or anxiety really isn't coming down, that's probably an indication that the step you've chosen is too hard for the youth. And so that's when we might want to kind of reevaluate the plan or the ladder and take a look at, hey, are we missing a step in between these two? Is there something that will help kind of bridge that gap a little bit more? So I guess to answer your question, we're not expecting the student to move on to the next step only when their anxiety is completely absent, but we do want to see that little bit of decrease in distress or anxiety before moving on to the next step.
Great, thank you. Okay, so the next question, it's around symptom accommodation and is teaching about mental health days and how they would be used in a limited way and why you may take one step in the wrong direction.
You listening might guess a little bit what we're going to say about this. So it's a little dangerous because it risks feeding into that idea that when I get overwhelmed, what I need to do is to stay away. And so I can't think of a situation actually where I've recommended them in that case. That being said, for kids where there's a lot going on and things are more severe, we might want to have some pre-planned sort of breaks in that maybe they go, Monday, Tuesday for the morning and Wednesday just for an hour and, Thursday, Friday for the morning. So it's better to kind of pre-plan that, kind of gauging where the kid's at rather than have them. I mean, every kid who's got school anxiety is going to want a mental health day at 8 o'clock in the morning when it's time to go to school. So that's what we kind of want to watch for. We do want to send the message that kids can cope.
And it looks like Dr. Catchpole might have been frozen. Dr. Anderson or Dr. Oh, okay, I think you're back now. Sorry, you froze for a moment there, Dr. Catchpole.
Sorry about that. I'm done.
Okay. So it looks like for the next two questions are fairly similar. So what can we do if parents are not willing to work with us? And what can you do if parents are not making changes at home or not willing to work with the school?
So this is really tough, and I think it's worth taking a look at or having some conversations with the family about what may be barriers for them to want to collaborate with the school on this. So in many cases, it really varies. It could be related to stigma about mental health challenges. It could be parents' own history and experiences around school and authority figures. It could be other things. So I think that that question's hard to answer because it does sort of depend on maybe what's keeping the caregivers from kind of wanting to be involved in developing that plan. I don't know if Dr. Catchpole and Dr. Alex, you have anything to add to that? Okay.
So I think we'll end the Q&A session there, just in the interest of time. So thank you so much, everyone, for submitting such wonderful questions. If we didn't get to your question, please don't hesitate to contact us at the Kelty Center. And we'll put up a slide here that has our contact details on it, including our email address and our phone number. Here we go. So our email is keltycenter@cw.bc.ca, and our toll-free phone number from anywhere in BC is 1 1-800-665-1822. So again, feel free to contact us with your questions if we didn't get to them. Thank you so much to our presenters, Dr. Anderson, Dr. DiGiacomo, and Dr. Catchpole. Thank you to all of you for attending today. And just a reminder to please fill out the survey that will pop up after the webinar closes. The feedback that we receive about these webinars is incredibly helpful to us in planning future ones. So good evening, everyone, and hope you have a nice night.